Hi, everyone. Happy Friday. Thanks for bearing with us before we are getting started. My name's Hannah Preston. Thank you all for joining us today. Before we jump into the context of our great meeting today, I want to hand it over to our interpreters so they can talk about their services that they'll provide throughout this meeting. Flora, can you hear us? Wanted to make sure that you can jump on if possible. Okay. Well, while she's waiting to get on, we will jump through. Yeah, so she'll be coming on bringing her services as she can. Again, thank you all for joining us today. My name is Hannah Preston. It is March 21st, and this is our first Lunch and Learn of 2025. Thank you all. I really appreciate you all being here. We are going to have a great meeting today. We have Neil Harrington from NC Child. He is our research director, and he will be going into our data cards. Before I hand it over to him, I also just wanted to give an update on my end. As you all know, I've been a part of this work for about a year and a half now, and I'll be stepping away from this role. My last day will be the 28th. I know some of our folks from Really Well have been notified, but wanted to just say thank you all for letting me lead this work and for being a part of this journey. I'm excited to support y'all after the fact. Neil, I will hand it over to you.
Excellent. Thank you, Hannah. First, before starting off, just wanted to thank Hannah for her incredible leadership around Early Well over the past year and a half or so it's been, and she's done an excellent job, and we'll miss her very much. So, hi everyone. I am Neil Harrington. I am the research director at NC Child, as Hannah said. I want to start also by saying thank you to all of you for being here today. And participating in all the Early Well activities in the Lunch and Learn series that Hannah's done such a great job of putting on. So I'm going to today talk about North Carolina's data card that we publish every year, along with all 100 counties that we publish cards for as well. If you attended the Early Well in-person convening late last October, I gave a similar presentation there. So today's presentation will be similar to that, but with updated data where we have it, and I've added a little more context in some places too. So Ari, if you can go to the next slide, we can go and get kicked off. So, like all of you, I was a child once, right? As you can see in the picture, I was also a child that loved to play golf and had a lot redder hair back then than I do now, at least on my head. My beard's still got a little red tint to it, but the point really is, right, that we're all children at some point. Something we all have in common. We know what that's like, and we know the challenges that come with growing up. We also know, right, that not every child in North Carolina might have had the good fortune that many of us might have had when we grew up, and maybe not given as many opportunities to succeed as many of us may have been given. And in many ways, right, the challenges that children face today are a lot different than what many of us might have had to deal with whenever we were growing up. So going to the next slide, Ari. So, through NC Child's county data cards and the broader research and data analysis that we do, we really try to understand these challenges that kids are facing across the state and in different communities across the state. And we take what we learn through that research to communities through our fantastic community engagement team led by Kelvin Stallings, who might be on the call too, our director of community engagement. And we talk to communities and see if what we learn in data matches the lived experiences of children and families in North Carolina. As many of you in this Zoom room already know, right, we track key indicators of child health and well-being in 5 categories in our county data cards, and we publish these every year. So on the screen there, we have the 2023 county data card, and then our most recent version, the 2024, right next to it. And later this summer, we'll come out with the 2025 state and county data cards. So I love data, and I could talk about all the data points on this card for an entire hour, and I hope all of you love listening to data too. But rather than kind of going through all 15 or so data points on this card here, I'm instead going to cover kind of 4 takeaways from North Carolina's data card, and then use some other data that's not on those data cards to dive a little deeper into some of these issues that we're looking at. And these issues that I'll dive deeper into are really some of the top focus areas of NC Child's policy agenda in this current legislative session. Sorry, you
Neil,
can go
we've
to.
gotten a request from our translation services if you could slow down
Oh,
just a little bit.
sorry. Yes, I'm a fast talker. I'm sorry about that, Flora. I'll slow down a little bit. All right. So the first of the 4 takeaways from the data cards is from the health and wellness category. So North Carolina has a fairly low percentage of children without health insurance, but it ticked up a little bit in 2023, the most recent data that we have available. And while we're on health, right, I want to go over some other data that's not on the data cards that really shows us that kids across our state are experiencing a mental health crisis, and they really have been for some time. So the next slide has the first key takeaway from the data card here. And it's in 2023, about 5% of North Carolina children did not have health insurance. So this rate has mostly declined since 2016, but in the most recent data, it increased to 5.2%, or nearly 130,000 uninsured children across the state. But North Carolina's rate of uninsured children is still slightly below what we see at the national level, right? Where about 5.5% of children are uninsured. And as Medicaid expansion goes into effect, started in December 2024, and will continue, or 2023, excuse me, and throughout 2024, we would expect to see this number decline once we get data for 2024. Even though expansion extends coverage to working age adults, research shows us that children of uninsured parents tend to see improvements in their own uninsurance rates when their parents gain coverage through things like Medicaid expansion. So we'd expect to see some continued progress here as the expansion process continues to play out and we receive data that reflects that. So you can go on to the next slide, Ari. While we're on health, I think it's also worth taking a look at an issue that we're really focused on in NC Child. That's the youth mental health crisis. So we know that more North Carolina youth are struggling with negative emotions that are precursors to self-harm and suicide, and reflective of poor child mental health. So in 2023, about 4 in 10 North Carolina high school students reported persistent feelings of sadness or hopelessness to the point that it disrupted their normal day-to-day life. We really started seeing this measure spike around 2015. We saw a slight dip last year coming out of the pandemic, but we're still well above where we were before the pandemic. And more importantly, we're still well above what we saw about 10 to 15 years ago when the youth mental health crisis really began. Let's go to the next slide, Ari. We've also seen a significant increase in the number of children diagnosed with anxiety or depression in North Carolina. Between 2016 and 2023, the number of children with anxiety or depression more than doubled in our state. And this increase was more than twice the percentage increase that we saw nationally over the same period. So in 2023, about 386,000 North Carolina children have been diagnosed with anxiety or depression by a medical professional. And that's almost certainly an undercount, right? Because that's kids that have been diagnosed by a medical professional with these symptoms. And we know that across the state, children don't have equal access to healthcare in their communities, or they might not have insurance coverage, which would preclude them from being able to be diagnosed by a medical professional. And there's probably a lot more children out there who are actually suffering from anxiety and depression. So you can go to the next slide, Ari. So youth suicides at the state level have also risen sharply over the last decade or so. In 2022, there were about 4 youth suicides per every 100,000 children in North Carolina. The number of youth suicides in 2022 was more than double the number in 2010. And it's not just high schoolers or older children, right? The number of youth suicides among children ages 10 to 14, right? Middle school age children was 5 times higher in 2022 than it was in 2010. And suicide, right, it's something that's affected many people, but it's especially tragic when it happens so young. Anxiety and depression are also something that many, if not all of us, deal with to some degree. I manage anxiety and depression, and I have pretty much since my dad took his own life when I was just 12 years old. Probably one of the hardest things I've ever dealt with in my life. Um, you know, I got through it relatively unscathed because of the support of a loving family with the resources and means to help me access the care that I need. And they still provide that support system to me today when I go through something tough. But too many kids in North Carolina, they don't have family resources and support to help them manage difficult emotions, or they live in communities where they can't access youth mental health care. And that's why it's really, incumbent upon all of us as adults to make sure that kids in our communities are supported, and why advocating for youth mental health supports in schools and communities across North Carolina is one of NC Child's top areas of policy advocacy. So you can go on to the next slide, Ari. So the second takeaway I really wanted to talk about is from the high quality education category. And I really wanted to highlight both the third grade reading proficiency rate and high school graduation rates. So North Carolina's third grade reading proficiency rate, the share of third graders who read proficiently or higher has made some gains since the big drop from the COVID-19 pandemic, but we're still well below levels that we saw before the pandemic. High school graduation rates, on the other hand, have remained fairly steady over the last decade or so. Sorry, you can go on to the next one. So in the 2023 to 2024 school year, about 48.6% of North Carolina third graders scored proficient or higher on the end of grade reading exam. In the 2020 to 2021 school year, the first year of testing after the pandemic started, about 45% of North Carolina third graders were proficient or better in reading. But back in 2018 and 2019, before the pandemic, we saw about 57%, almost 60% of third graders across the state that were reading at an appropriate level. So we're still almost 10 percentage points below the level we were at about 6 years ago, and that there's still a lot of ground to cover to make up for those losses during the pandemic. So you go to the next one, Ari. And of course, right, there are a number of interventions that improve literacy rates, which school districts across the state are deploying to get third grade reading proficiency back up to pre-COVID levels. And these rates are inching back up. We know that one of the key ways to promote early literacy among kids is by reading to them at a young age. And that's the goal of programs like Reach Out and Read, with which the Early Well initiative is really focused on expanding. But less than half of kids 5 or younger in North Carolina are actually read to daily, which is a pretty similar rate to the nation overall. So this number also looks very different based on the income levels of children's families. For low-income families, those earning less than 200% of the federal poverty level, or about $50,000 for a family of 3 in 2023, more than 70% of young children are not read to daily. It's the exact opposite for children in higher income families. About 2/3 of children in well-resourced households are actually read to on a daily basis. As we all know, right, families are exposed to Reach Out and Read through well-child doctor visits. And some other data shows us that fewer children on Medicaid in North Carolina are receiving well-child visits than in years past. Percentage declines compared to past years are largest among the youngest children with Medicaid, which can complicate delivery of programs like Reach Out and Read if these trends aren't reversed. Let's go to the next slide on high school graduation rates, Ari, and we see that high school graduation rates, on the other hand, have had kind of the opposite experience as third grade reading. In North Carolina and across the country, high school graduation rates increased during the pandemic, but then normalized and fell back to pre-COVID levels in the years after. So some research from the Brookings Institute suggests that this was due to states really reducing graduation standards in the immediate aftermath of the pandemic, and then kind of returning those standards back to their norm once we came out of it. So in the 2023-2024 school year, North Carolina's 4-year high school graduation rate was about 87%, the same rate as a similar measure at the national level in 2023, the most recent year that we actually have national data for. And as you can see on the slide, right, high school graduation rates have largely been in this 86 to 87% range in North Carolina for much of the past 10 years. Excuse me, the next one, all right. Right. So how do we solve this? How do we get third grade reading scores back up, and how do we improve high school graduation rates beyond where they've been at for the past 10 years? We know that from research, right, that high quality education starts early. And research shows us that going to high quality childcare centers can contribute to gains in things like third grade reading and high school graduation rates. Some Duke researchers from several years ago found that increased funding for Smart Start and NC pre-K spending boosted third grade reading and eighth grade math scores for students that attended these programs and for their peers that did not attend high quality childcare programs. So those positive impacts from high quality ECE really spilt over into the larger student population. Other research shows us that high quality early childhood education can improve high school graduation rates by as much as 11 percentage points. There's also a host of non-educational impacts like better health outcomes as adults, higher lifetime earnings, improved employment opportunities, lower criminal justice system involvement, and more. All right, you go to the next one, all right? Right, but as many of you know, right, North Carolina's childcare system is struggling. One of the biggest problems that we see in childcare is cost. Childcare is often just too unaffordable for families to pay for, right, which can lead to parents exiting the labor force instead of devoting such a large portion of their paychecks just to pay for childcare. So center-based care for infants in North Carolina averages a little over $13,000 per year. For toddlers, it's not much cheaper. It averages about $12,500 per year. You can go to the next one, all right. And for context, right, both of these price points are more expensive than in-state tuition costs at UNC Chapel Hill in the most recent academic year. So it's now become more expensive to pay for your child's education in the first critical years of their life than it is to pay for college tuition at one of the best universities in the state and really the country. You go to the next one, all right. So as shares of median incomes, we see just how unaffordable the cost of childcare is for families. Infant care represents almost 11% of the median income of a married couple in the state. It's about 40% of the median income of a single mom, and around a quarter of the median income of single dads. All of these shares of median incomes, right, are above levels that economists consider an affordable price to pay for childcare. And these are median incomes, right? So that means about half of people are below this median level, half of people are above it. Parents of young children are far more likely to fall below it, given that they're earlier on in their career, they're likely making less money. And so childcare is even more unaffordable than it appears in the slide here. Let's get the next one, all right. So because of this high cost of childcare, right, and other issues like the lack of childcare supply that I haven't even really touched on, some parents are forced to drop out of the labor force altogether just because they can't afford or find childcare for their kids. The report that we published last year with the US and NC Chamber Foundations found that about 35% of parents who experienced employment disruptions last year reported leaving the workforce because of childcare issues. Some other data shows us that there were about 100,000 fewer parents of young children in the labor force in 2023 than there were in 2019, just before the pandemic. You go to the next one, all right. So, beyond these developmental impacts that childcare has for children, or that they're missing out on if they're not going to high quality childcare, the lack of accessible and affordable childcare also leads to these workforce issues, which pose a huge immediate economic impact. The Chamber Foundation's economic impact analysis we published with them found that issues in childcare cost our economy $5.65 billion per year. Most of this $5.65 billion is the economic cost to businesses from turnover and worker absenteeism, which adds up to about $4.29 billion per year. The rest is what we're missing out on in state revenue from these childcare issues, right? You can see on the slide, these issues cause us to forego an estimated $1.36 billion per year in revenue collections. So that's $1 billion we could be spending on roads and bridges, on water infrastructure repairs, or even childcare services itself. Let's get to the next one, all right. As a follow-up study to the Chamber report, we partnered with the North Carolina Department of Commerce last year to look at how addressing childcare could benefit the workforce and grow our economy. We found that solving these issues for parents could increase our state's GDP by up to $7.5 billion a year and add up to 60,000 jobs to our economy. right? That's a huge economic impact, and it's one that could get a lot worse if we don't support our childcare system and prevent it from collapsing, and really ensuring that that families and children have access to affordable childcare. All right, so the next slide is our third takeaway from the family economic security category. So in North Carolina, right, household income has increased in recent years, but we still saw a pretty big spike in food insecurity rates in 2022. So the next slide has those income increases. Excuse me. So median income has increased the most for households with children in North Carolina, rising nearly $26,000 since 2017. Incomes for all households in the state have also risen, but not by as much, right? Rising by about $20,000 over the last 5 or 6 years. So this strong income growth has also resulted in a lower number of kids in poor low-income homes across the state, right? And that's a trend that we've seen really play out over the past decade or so. We've seen incomes rising and fewer children living in poor or low-income households. So then you go on to the next slide, Ari. But right, as incomes have climbed, so have the prices of goods and services that families rely on. And that really eats into their ability to provide the basics for their children. Gas, vehicles, housing, groceries, and childcare have all increased considerably over the last few years. And I really want to focus in on one category here in particular, right? That's the cost of food, which is up by about 25% nationally since 2019. You can go on to the next one, Ari. So these higher food prices, right, they seem to have been some of the most difficult for parents to grapple with, particularly those with lower incomes, because high food prices have really contributed to a really big spike in childhood food insecurity that we saw in 2022. After food insecurity rates declined between 2017 and 2021 in North Carolina, there's a strong increase in 2022 to about 19.6% of kids living in food insecure homes, which really erased the gains that we saw over the last 5 years combined. So about 1 in 5 children live in food insecure households in the state. That's pretty comparable to the nation overall, as you can see on the slide. But for all of the past 6 years of data, North Carolina has had a higher rate of childhood food insecurity than what we see nationally. And the next slide, right, shows us that there's significant disparities across counties in North Carolina. In the 10 counties with the highest child food insecurity rates in the state, a third or more of children don't have consistent access to adequate and nutritious foods. Hyde County over on the coast, right, has the highest, where about 40% of kids live in food insecure households. And choosing between, providing enough food for your children, or paying the light bill, or covering rent, or paying for medical care, that shouldn't be a choice that any parent has to make. But it's one that too many parents are making across North Carolina. And that should really be a problem that we all want to and should be able to come together to solve for North Carolina children. You can go to the next one, Ari. So, beyond the fact that no kid should have to go hungry, childhood food insecurity has long-term impacts on children's development and opportunities in life. Food insecurity, right, either not getting enough food or not getting enough of the right food leads to nutrient deficiencies in children, which impairs cognitive development among kids and their ability to really learn in the classroom. Child hunger can increase the chances of chronic conditions in adulthood, which can increase public health spending as children age. And other research shows us that childhood food insecurity makes children more prone to develop mental health conditions like anxiety, depression, or suicidal ideation, which really start to pop up in those adolescence and teenage years. But we also know that policies that support children's access to food help combat some of these negative impacts from hunger. So by implementing policies that improve children's food access, we can help prevent some of these negative developmental impacts in kids. All right, so the fourth takeaway in the next slide is from the nurturing homes and communities category. So from the data card, right, we know that North Carolina's child abuse assessment rate has been inching back up since COVID-19 after several years of declines. But some other data shows us that kids are staying in the foster care system longer without a permanent placement or a resolution to their circumstances. So the next slide has the child abuse assessment rates. So North Carolina's child abuse assessment rate, right, or the number of child abuse complaints that local offices investigate, declined notably between 2017 and 2020, but it's inched back up in the past few years of data. In 2022, there were about 47 child abuse assessments per 1,000 kids in the county, down from about 56 in 2017. Other data on the next slide shows us that many children in the foster care system are there longer without the resolution to their case or a permanent placement. So in fiscal year 2000, it took about 362 days, right, or about a year for half of children to exit care. Fast forward 20 years, right, it's now taking about a year and a half for half of kids to exit the system. Fiscal year 2000 was actually the only time in the last 23 years of data that this median point was under 1 year. And other data shows us that placements are far more unstable in that first year of custody too. We have higher shares of kids bouncing between 3 or more placements in their first year of what's already, right, a really traumatic experience for them. So the next slide on permanency rates, right, or the share of children with permanent, stable living placements after specified periods of time tells a similar story. North Carolina and its counties aim for about 40.5% of kids to have a permanent placement back at home or with a relative or through adoption or some other approved living situation 12 months after a child enters DSS custody. The state overall, right, falls well short of this goal with a 12-month permanency rate of about 28% in fiscal year 2024. So put another way, right, almost 3 out of every 4 kids who exited care in fiscal year 2024 did so after spending more than a year separated from their families without a permanent placement or their case resolved through the court system. And of course, right, more time in the system can increase the likelihood that children develop ACEs or some other traumas that really stick with them for the entirety of their lives. So you can go on to the next one, Ari. And we know from some other data, right, that courts across the state have been slow in clearing child welfare-related court cases. There's multiple reasons why this is happening, right? Some counties have just 1 court date a month for child welfare cases. We know that parent attorney pay is really low. It was cut about 10 or 15 years ago, and it hasn't been updated since then. It's about $65 per hour, which leaves very little money left over that attorneys are bringing in after they account for their expenses that they have. That leads to there not being enough parent attorneys in counties across the state to really serve the increased caseload of kids in the system. And we also know, right, that hearings are postponed sometimes because the court scheduled a child welfare court case in the afternoon. They got backed up and they had to bump that back. They had to issue a continuance order and delay the case. And if a county only has 1 court date a month, that automatically pushes it back at least 30 days. And some of these problems, right, that we see in the system are fixable through policy. We know that 1 judge to 1 family in counties that are implementing that's helped a lot with reducing continuance orders and expediting child welfare cases through the system. More child welfare court days allow counties to clear those cases out of the court system. Separating juvenile and child welfare court days as well have also helped, and better parent attorney pay and more can really all help solve some of these court issues that we see. You can go on to the next one, Ari. So while kids are in the child welfare system, the types of living situations that they're in are also changing. We've seen declining shares of children in the child welfare system with initial placements in either foster or relative or parent or guardian homes over the last several years. About a third of kids in DSS custody are in foster care homes right now, which is the lowest point that it's been in the past 25 years. We know that foster care providers have declined considerably over the past few years, right, decreasing by about 20% between 2021 and 2023, which has certainly contributed to this trend. We've also seen the percentage of kids in the care of relatives decline over the last several years, almost consistently declining since 2016. And children staying in the home of parents or guardians has also largely declined since 2000. And of course, right, to the extent that we can keep kids that have to be in placements outside of the home with relatives or in kinship care that can preserve their family connections, their culture, and their community, the better likelihood of positive outcomes that those kids will have. Financial support to kinship caregivers can make it easier for relatives to do that. And the provisions that we saw included in SB 20 a couple years ago will certainly help with that. But while the share of kids in foster care or relative care or remaining with parents has declined, we've seen kids in what's called other placements increase pretty considerably, right? These are some other DSS approved settings that aren't the typical placements, like foster care homes with relatives, and group homes, and therapeutic care and corrections facilities, or hospitals, or something else. And we know anecdotally, right, that some of the kids that might be falling into this other category are kids that we hear stories about, of kids sleeping in DSS offices or hotels rented by DSS because they can't find traditional placements in their communities. These unstable living situations stand to place even more stress and trauma on kids who are already in very challenging circumstances. So, really focusing on making it easier for relatives to take in children in the system, increasing the number of foster care homes, and other solutions that improve kids' experiences during a pretty traumatic period of their lives is really important to improving outcomes in the child welfare system and outcomes for children that are in some of our most vulnerable circumstances in the state. Go to the next one, Ari. All right, that's it. Thank you very much. I'm happy to answer questions. I think there's a few in the Q&A, but I'll pass it back over to Hannah.
Yeah, Neil, thank you so much. That was great, very insightful and helpful to show how important this data collection is for the work we're doing in general with children and families, but specifically with those policies we're working on with Early Well. Before we jump into the Q&A, if you haven't put your questions in, please do. Neil, I wanted to ask you where folks can find these data cards and if there's just statewide data or if it's broken up by county.
I'm muted. Oops, sorry, I was on mute there. Yes, let me pull up the link. They're on our website. Let me pull up the link and I'll drop it in the chat here. Yes, you can check out. Actually, I'm not sure. Can I share in the full chat, Hannah?
You should be able to, yeah.
Okay.
And if not, I can drop it in.
Yeah, so we have the state data card and data cards for all 100 counties you can print out and save on your computers. Available on our website, and we just shared that link in the chat.
Perfect. And you had mentioned that these are the 2024 data cards. Can you give us any little bits and pieces of what's to come in the 2025 data cards or when they'll be out?
Yeah, so we're planning on having the 2025 county data cards out this summer. Last year, I think we released them around early August. I think that's the goal we're shooting for this year too. Some of the data I just shared today had 2023 data in it, and that is largely what you'll see in the 2025 county data cards is 2023 data. That's just now started to come out, so we kind of give it about half a year to try to get all the data that we collect for those data cards to be published so that we can collect it and put it out.
Perfect. Thanks, Neil. And when you look online at the website, on the NC Child website, where you see the data cards, there's an awesome dashboard where you can see all of the data that Neil was talking about, but also downloadable versions for North Carolina and each county as well. So if you need to use those in your own lines of work, I definitely encourage that. The research and data team has done a great job of making that a very user-friendly resource online. Okay, now let's get to some of these Q&A questions. One of the ones that was asked was, what has made the most impact on reading proficiency gains?
Yeah, that's a great question. In the short term, I'm going to cite some work that I've done with a group in the Mississippi Delta. They have kind of an interventionist program, and I think in the short term, those really have a lot of impact on kids passing the third grade reading exam. So those are programs that work with students that have identified need. They're at risk of failing the third grade reading exam, and work with individualized tutors or in group settings to really help address the challenges they're having with literacy. And some research that some folks at the University of Memphis have done of that program shows that kids that participate in it and schools that participate in it tend to have really strong gains in third grade reading after kind of receiving the full battery of those programs. So I'm sure I'm citing an example from Mississippi that I know that I've worked up, but I'm sure there's a lot of programs that are doing similar interventions in North Carolina schools across the state. In the longer term, right, I think the participation in high quality childcare early on in a kid's life, that's that's some of the most impactful investment in programming you can do to improve things like third grade reading scores, because it establishes those literacy skills early on, and allows them to not need the intervention later on before they get to third grade, right? And the idea behind Reach Out and Read is similar too, right? It's that kids are being read to, and they're developing those language skills early on, which helps them develop it before they need an intervention. My wife just had a baby 2 months ago, and I just had a baby 2 months ago, and we try to read to her every single day, at least a couple times a day. It's difficult to do sometimes, but it is well worth it in the long run. And I think those are probably some of the best ways you can improve those rates.
Thank you so much, Neil. And in general, I know we are a couple of years out from the COVID-19 pandemic. Can you talk a bit about how this data has changed post-pandemic, and as we're still seeing those effects?
Third grade reading.
Yeah, or just in general with some of the data that was on the different data cards.
Yeah. Third grade reading, right, is one that in the data card, I think, where you see the most difficult time catching back up. Kind of, you saw the biggest decline there, and there hasn't been. It's inching back up, but we haven't seen it catch up too much, right? A lot of the mental health outcomes, which we don't really have many mental health outcomes in the actual data card, we will in our child health report card that will come out in about a month at our State of the Child Summit. But a lot of those immediately following the pandemic spiked even more than what they were. Things like the what I cited in the slide of the number of kids, percentage of kids with persistent feelings of sadness or hopelessness. That spiked really coming out of the pandemic. It's dropped in the most recent data a little bit, but it's still well above what it was pre-pandemic. I think those are two of the most challenging ones, probably. And of course, the food insecurity rate. That was another one that, given the high amount of inflation we've had, mainly in 2021, 2022, that contributed to higher food prices. That seems to have really contributed to a spike in food insecurity, and that is largely among kids that come from lower income households.
Thank you. Last question is very general, but how can we best support the work that NC Child is doing when it comes to the data cards? And then again, just in general.
Yeah, I think letting us know how you're using it and how we can improve it to better serve you all, right, and the work that you all do, and being a great partner in the especially in the direct service work that folks are doing, and how our data and research can help inform that. But also, right, just kind of coming to our community engagement events and telling us if what we see in the data is what matches the lived experiences of children and families out there, right? I can be a nerd and look at data all day long and tell you what it means and talk about what it might mean, what it could mean, and what it doesn't mean, but that doesn't trump the lived experiences of people that are actually on the ground feeling these issues and dealing with the issues day in and day out. From an advocacy perspective, those stories are much more impactful than any presentation I can put together too. So I think that's another great way, is just getting involved in advocacy yourself.
Perfect. Thanks, Neil. Another question that we got was how folks can find this recording and the data cards after the fact. We will be doing a follow-up email for folks that are watching this on the recording and that are watching it live. But if you wanted to share it, we actually post all of our videos on the NC Child Earlywell website. So that is the link, that Earlywell website. Within that is embedded our YouTube channel. So you will see our past 4 Lunch and Learns. We also did a kickoff meeting in January. So if you're new to Earlywell and really want a full deep dive of how we got here from our start in 2019, that's where I would suggest to go. So this will be uploaded there, as well as a follow-up email. It looks like that is all of our questions. So I wanted to thank you all for joining us today on your Friday. Our next meeting is on June 20th from 12 to 1. That feels like a long time away. We'll be doing these quarterly. So again, thank you all for joining us. We're so happy to have had you here, and have a great weekend.